this Saturday at St. John's Catholic Cemetery. They're celebrating wreaths across America, and you can participate by purchasing a wreath. And on the 17th at 12 p.m., volunteers will be placing those wreaths at all of the veteran grave sites in St. John's Cemetery. Bart, how many do we have?
2,300.
2,300 veterans laid to rest in Jackson. So if you can support, wreaths are only $15. Just call St. John's Catholic Cemetery.
3 for $30.
So you can buy 3.
Yep. Joining us now from the PIIC Center Infectious Disease Specialist, Dr. Vivek. Welcome back to the show.
Good morning.
Good morning.
Good morning.
I'm starting to feel like a infectious disease expert myself because of the amount of children that I see, kids that I coach that have been sick. And one thing I've noticed is the symptoms are so much more visible this time around, whether it's RSV, flu, I'm hearing influenza A. What's going on out there?
Well, I think we've had a much earlier flu season, and this year RSV has been particularly bad. So I think you've got the trifecta in some ways. Yeah. You had COVID, which is coming back. You have flu A, and we've started seeing flu B too, and RSV. And for the last couple of years with the masking and limited interactions, we kind of forgot that flu can be particularly bad.
Yeah.
So and this year that, plus the kids kind of mingling around, because I think the lack of social interactions between both parents, grandparents, kids, kind of, we are having a lot more parties, and viruses like us, as I've said before, and the more we intermingle, especially if you're carrying one, we are spreading them across. And schools, especially preschools, kindergarten, are petri dishes of all the weird bacteria, viruses that you can have.
Are some of these diseases that we have, are they lingering longer than they have in the past?
Not necessarily. I think what the trouble is that you're getting over one and you're getting the second one. So that's so it just feels like the train isn't finishing. You get over one, a couple of days later you get a different one, and then so it's the cycle just keeps on going. And unfortunately, I suspect this winter is going to be a bad winter.
Yeah.
And I think once it gets into a place, a school, a place of business here at GTV, we've got 2 or 3 people out sick. So it's almost like Christmas break is timed nicely to just get everybody out of the congregate settings and to.
But we don't, because that's when the holiday
Families.
plays are
Families.
and everything like that. So it's hard because you want to have some normalcy, but also you're dealing with so many kids that are sick. It's a tough call.
Yeah, I think that's going to be the tough part of it, because if we go back to masking in some ways, the incidence of the illness is going to decrease. I mean, you're not going to be completely protected, but masking, I think, is going to help to decrease some of the infections that you're going to pick up from somebody around you. The trouble tends to be getting people to go back to masking, which I think has become kind of very divisive in some ways. I think if we kind of forget the rhetoric around it, masking does help in terms of decreasing respiratory infections.
Yeah, it's funny how that flips so quick. Now if you see someone with a mask on and you're outside of the hospital, you wonder what's wrong with that person.
I'm seeing it more though.
Yeah, a little bit more during the holidays,
And really, it depends on where you are. You know, if you work in healthcare, nothing's changed. It's masks everywhere. And if you go to a nursing home or a hospital, same thing. So, but you mentioned the 2 things that we know work: the masks, social distancing. And the third thing, which we also have, is the vaccinations.
Yeah, I mean, I think vaccinations, hand washing, kind of, if you're sick, not visiting people around you so that you don't spread it around, is going to be important. But vaccination is fairly important. We have a fairly effective flu vaccine. We have the bivalent COVID booster. We don't have an RSV vaccine. There's studies and there's a candidate that was fairly promising, but we have a flu vaccine which, in terms of its effectiveness in preventing severe disease, is fairly effective. And all the vaccines, whether the high valent or the regular strength flu vaccines this year, have 4 strains of, so they have the 2 flu A and 2 flu B strains. So I would recommend getting it even if you've had the flu, because what we forget is once you've had the flu, it could be flu A 1 strain, 2 months down the line you have flu B, which doesn't happen commonly but has happened to me once. So, I mean, get the vaccination, it's not too late.
What, for parents parents watching, your kids maybe have been sick for a week, week and a half. Maybe you've been feeling weird for a week. When should you seek treatment, or when a lot of parents, you're looking at your child thinking, okay, what's the deal with this fever that won't go away? When should we go to the hospital? When should we go to the urgent care? When should we seek that treatment?
So I think earlier on, especially if I have a high fever in a young kid and who's been perfectly fine, I would get them checked both for COVID and flu. Probably RSV too. The thing is, the first two, both COVID and flu, have oral treatment options that you can use within the first 48 to 72 hours, at least for flu, and a little bit longer for COVID. So if you check that, they're negative, kind of then wait. If the kid is becoming confused, kind of you see that he's having trouble breathing, then definitely go to either the ER or the urgent care.
Okay.
But early testing is important because at least for a couple of those viruses, we have treatment options which will make you feel better fairly quickly. The other thing is what we've noticed, and it's not been as well reported here, but once you get over the flu, and it's been well recorded from a long time, that you can have a secondary bacterial infection down the line. So you can develop a pneumonia, because what happens is the initial viral infection kind of disrupts your immune system, so you're at much higher risk for developing pneumonias kind of. So if you have a kid or even an elderly parent who got the flu, was getting better a week later, now starts having severe fevers again, chest pain especially, when they take a deep breath, worry that they might be developing a pneumonia. That's a sign that you should probably go and seek help fairly quickly.
Okay.
And I think the advice has been the same for 100 years. Stay away from people, get plenty of rest, drink plenty of fluids. That's part of the cure.
Yeah, you will feel miserable, but at least for a couple of those viruses, we have oral options. And both Tamiflu, which is for influenza, as well as Paxlovid, which would be for COVID, are fairly effective. I think once you get on treatment earlier on, the key is getting on appropriate treatment early, you feel better fairly quickly.
I've talked to two people that had COVID. They were experiencing symptoms, did the self-test. One person, their doctor said, I can give you the Paxlovid. It's easy, it's available readily. The other person, their doctor said, no, I'm not doing the Paxlovid. What's going on with that?
So the issue is twofold in terms of, or maybe onefold, I would say. If you think that if once you get COVID, how sick are you going to get? So my bias is that even if you have COVID now and you've been vaccinated and you are in the elderly age group, or you have any other conditions like heart disease, lung disease, I would recommend treatment. And because we are seeing an uptick in hospitalizations, again, in patients who've been vaccinated initially but haven't gotten the booster. So there is, COVID is still around, and it's going to be around. And I think if you get sick, get treatment. And if you don't find your family physician isn't willing to give you Paxlovid, maybe go to the urgent care. The urgent care here, and both along with the hospital, are fairly aggressive in giving you Paxlovid. The issue tends to be if you are on any other medications that interact with Paxlovid. That becomes a little bit more difficult to deal, and it might be that the family physician is not comfortable with dealing with the drug-drug interactions.
Interesting.
That could have been it.
That could have been it.
But it's not because of the supply or the effectiveness or anything else.
The effectiveness is great. As somebody who's got Paxlovid, I think you took it within 6 hours, you feel like you're back to normal.
How about amoxicillin? I heard there's a shortage in Michigan. Is that?
So some of the oral antivirals that are used in the outpatient setting, especially the ones that are used in kids, so amoxicillin liquid is in short supply, partly because I think the first rule of the thumb, depending on where you end up going with that sore throat, is they'll say, you don't have COVID, you don't have flu, you have a bacterial infection, take amoxicillin. And the amount of kids who have that going on right now is phenomenal.
Right.
So everybody and their brothers and sisters are getting amox liquid. So that's the issue.
Now, is all of these various viruses, the transmission of the viruses, once it's in the house, is it going to spread? Can you pretty much expect that?
Yeah, I think unless you kind of put them in a separate room out of the basement, you're probably going to get it. So if you're have a very young kid who you need to be around, then it might make sense for you to kind of wear the mask. Decrease, you won't be able to put the mask on the kid that easily, especially if they're coughing, but at least you yourself wear a good mask and see if that helps you, plus hand washing as much as possible.
As we learned last week, there's over 3,000 germs on your hand.
Not mine.
Yeah, there's 5,000 on yours.
So and that gives you really double protection if the person that is sick wears a mask, and then the people caring for them wearing the mask. Do whatever you can. I mean, if there's some things you can do that are so cheap and easy, why not?
Yeah, especially that you feel miserable with all of these infections, and especially if you have 2 or 3 kids in house and they are less than 12 or 13. It'll feel like a never-ending story. You get over one, the other one gets sick, and then in this time you probably get sick too, and it just makes you wish, well, I don't know, at least when I had kids, it made me wish that I didn't have kids, actually.
Makes you wish for a long vacation, I can tell you that.
Oh, it's nice when they grow up and leave the house.
Well, I guess.
If they leave the house.
So we've, over the last 4 weeks in the state of Michigan, the COVID cases are on the rise. What's the trajectory? Where do you predict we're going to be with COVID this winter?
I think we're going to see an uptick, definitely. We'll see an uptick. The competition, it's going to be a competition between flu and COVID, and especially if you're elderly, if you have any underlying immune compromise issue, you should be very careful.
Nice. All right, stay safe, stay well.
Stay healthy.
And thanks for all your time with us today and your knowledge. We appreciate it.
Thank you.
Dr. Vivek, infectious disease specialist at the PIIC Center in Jackson and also at Henry Ford Jackson Hospital. More of the morning show in just a couple moments.